we are demonstrating about the CPR. It is a basic line of technique which should be known to everyone. So here the CPR involves mainly the
CPR means
cardiopulmonary resuscitation. The main purpose of the CPR is to restore the circulation to the vital organs for the
means CPR, cardiopulmonary resuscitation failure. Okay, how to assess circulatory failure?
The circulatory failure is been assessed by mainly by pulsation at the neck region. The pulsation can be sensed by the palpation by the ring finger, middle finger and forefinger. Gently pressure is applied.
See,
then
you just note down the midline of the neck, trachea. Okay, move 2.5 centimeter to 3 centimeter on any one side, lateral sides. Okay, then feel for the pulsation. This is central pulsation. You are feeling the carotid pulsations, and should not be felt on the either side at the same time. You know, because it will hamper the circulation to the brain. Okay, either you have to feel either on the left or on the right side of the patient, and within 20 seconds you have to complete it. So don't press for longer time. Okay, if you couldn't find that pulsation in the patient, that is the alarming sign to call for help first. Shout on the patient, make him to get awake. If not, then you have to call for the help, and that is the indication to start the cardiopulmonary resuscitation.
Next, if pulsation is not felt, then we should initiate the CPR procedure. The main step of the CPR procedure is to compression. The compression is mainly done by the resting on the knees. Both hands should be placed on the sternum, lower part of the sternum.
See, this is the kneeling posture. Okay, where your elbow should be straight, should not be flexed. Okay, and you explain this one. Explain that.
The pressure should be the pressure should be applied on the heel of the hand, so that the both hand pressure should be.
ज़्यादा press मत करो.
The both hand pressure should be felt on the one point, so that the effective CPR for this effective CPR procedure. So here the main we should ensure that the pressure should be felt on the one point of the body.
See, the pressure what you exert, it should be exerted on the heel of the palm. Okay, and both the hands are placed one over the other, and whatever the pressure you exert is not by using your arms. They should be, you are using your body weight. Okay, explain.
And next we should apply the pressure slowly by using body weight. The slowly compression is started at the rate of the 2 compression per second, so that
means approximately 100 to 120 compressions per minute.
So and middle at 30 compressions, for every 30 compressions 2 breaths can be given with the help of the airway. And next, with the help of the umbo bag, the airway the mouth breath can be given.
See, 1 second. First what you have to do, you have to tilt the head. Airway becomes straight. Okay, the conduction, you are making the conduction bit easier. This is the first step before putting a compression. You have to tilt the head so that the airway becomes straight, and lift the chin. Okay, if you are doing the CPR in the hospital setup, you can use this kind of airways based on the age of the patient, like a pediatric patient or adult patient. So this can prevent the backfalling of the tongue also, which can obstruct the airway. Okay, you put it and rotate it, and you can fix with the plasters on the either side. Okay, don't block this mid portion. So this will secure the airway. Okay, and once airway is secure, if this is not possible, okay, then you can just lift the chin.
Next, with the help of the umbo bag,
So you see, if on every 30 compression, you have to give 2 manual breathings. Just I'll tell how to hold it. Okay. See, this is the usually we get umbo bag with a rubber cushion so that the air should not get leaked off. Okay. So once you can fix on the umbo and fix this with the chin. This is the method of holding. Okay. And afterwards you give 2 effective compressions. How fast? The way how you breathe. Okay. 1, 2. Okay. If this is not, umbo is not available, then you have to go for mouth to mouth respiration. Okay. If it is available, better to use umbo only. Okay.
breathe by pinching the nose, and next while doing compression, so that we should ensure that the chest should be the recoil of the chest should be seen. And next is the compression.
At what depth the chest could get compressed? Itna?
5 centimeter.
So to gain the effective compression, the chest compression should attain at least 5 centimeter of compression. Okay. Next.
At last, the compression is continued until the any medical practitioner arrives.
So chest compression has to be continued until unless we get the ASL, advanced life support. ALS. Okay, this is BLS, basic life support for the layman. So, or else if the patient regain the consciousness, the circulation started, there is also a indication to stop the chest compressions. So this is about the cardiopulmonary resuscitation.
Adults.